Just days before National Jewish Health's Legends of Atlanta tribute honoring Ambassador Andrew Young, patrons gathered for a special evening hosted by Julie and Paul Hagedorn. Held at their beautiful home, the reception offered guests the unique opportunity to meet Ambassador Andrew Young and hear his inspiring words. Attendees also learned more about the life-saving mission of National Jewish Health, leading the way in research and treatment for respiratory illness, helping patients breathe easier and live longer.
And it's a pleasure to have you all here at our home. For more than 50 years, my family has proudly supported National Jewish Health, dedicated to improving lives through innovative research, treatments for respiratory and cardiac and immune disorders. Your presence here shows your shared commitment to this important cause. And we're honored to have Ambassador Andrew Young here, a true advocate for healthcare equity. Thank you for being here and for your generous support for improving lives in our community. Now I'd like to introduce Mark Krause from National Jewish Health.
Thank you for that. Well, good evening, Ambassador Mrs. Young, and all the folks here tonight. On behalf of National Jewish Health, I want to thank you all for your great support as we honor an extraordinary man with our humanitarian award. He's quite an extraordinary gentleman, and we're very proud to be involved in this event. I want to first also thank Paul and Julie not only for their hosting tonight's event in their beautiful home, but also because their tremendous generosity in providing a $100,000 commitment to this event between Paul, Julie, and Paul's sister Sue. And we are tremendously grateful as a great advocate for National Jewish Health. It's really meaningful to us. So thank you. You know, I think there's a lot of people in this room who've never knew about National Jewish or don't know much about National Jewish. So if you'll bear with me, I want to take a few minutes to talk to you about where we come from, what we're all about, and where we're going. And then I'd like to introduce one of our leading scientists to talk a little bit about what we are. National Jewish was established in 1899 during a previous pandemic of tuberculosis in Denver, Colorado, at a time when it was thought that if you went up into the mountains and you got sunshine and the fresh air, it could help in terms of treatment of tuberculosis. And although it seemed like just an old wives' tale, it has turned out to be true. At altitude and with fresh air, it does retard the progression of tuberculosis, coincidentally. The trouble was that a lot of people from all over came out to Denver with hopes of improving their health. Many of them didn't have money. If you had money, there were a lot of sanitaria around the Denver area you could go to and be treated. If you didn't have money, you were a pluck out of luck. And what was happening was that people were dying in the streets of Denver. So enter this extraordinary woman, Frances Weisbart Jacobs, who motivated the other women from her synagogue in Denver to go out and distribute fruit and blankets and take care of the folks who were in the street as much as they possibly could. But for Frances, this wasn't enough. She ultimately became one of the founders of the United Way, incorporating other faith leaders in the Denver area. She said, we have to do something, we have to create a hospital. And she motivated the local Denver Jewish community and then ultimately the national Jewish community through a fraternal organization called B'nai B'rith. And they opened this hospital as a free, non-sectarian hospital solely to treat and research respiratory disease, particularly tuberculosis. If you had money, you went someplace else. If you didn't, you came to National Jewish. And for the first 70 years of our existence, no patient ever received a bill from National Jewish Health. It was all free. It's pretty extraordinary. In 1969, with the advent of Medicare and health insurance, we started to be able to accept payments. And now, of course, we'll take anything you got. We've got American Express, Discover, whatever, anything but Bitcoin, and we're working on that. We have always stayed true to that founder's spirit. We have never turned away a patient for their inability to pay. And every year, we continue to provide tens of millions of dollars in subsidized care, and we're very, very proud of that. It's been quite something. And we come to this time today, even after spending all that money just to provide care, as the leading respiratory hospital in the country and probably the world. And among the top 6% of recipients of NIH funding, which is pretty extraordinary for our size. And at least as of 10 after 7 tonight, we're one of the top 6%, but nobody knows what tomorrow is going to bring. Uncertainty is the only thing we're sure of at the moment. I joke, but it's not a joke. The reality is, it's something very special that National Jewish has been able to accomplish through all these years. And it's important that you understand and appreciate that we are an institution worthy of your generosity. Another reason you may not have heard of us is because we're small. I mean, people do come to us from all over the world because of our model of care. We are often seen as the solution shop for the most challenging conditions that people face in respiratory, immunological, and cardiac medicine. We are often the last resort for people, the last best hope. And because of an extraordinary model of care that we have, doctors have said we don't have necessarily the smartest doctors in the world, forgive me for that, but we may. But it's a model of care that allows our physicians to spend a great deal of time and collaborate with other physicians in other areas of medicine that allows us to get in deep and find the answers for people who've not been able to get good outcomes anywhere else. And that's what separates National Jewish in the world, and we're very excited about that. Underlying all of that has been research. From the first days, we built the first freestanding research facility that was not on a medical school campus. And that was in the 1960s. So we've always been very forward-thinking, always been very committed to it. We have made some, occasionally you make major discoveries. We discovered the IgE molecule, which, to those who understand, it's the allergy molecule that starts and triggers the allergic response. Well, when you discovered that, then we were able to develop medications that has relieved the suffering of tens of millions of people around the world. That's pretty dramatic. We also were able to accurately describe the mechanism of what's called the T cell, which is a very important part of the immune system and has led directly to the immunotherapies you see today for cancer and other diseases. So it's great to have big discoveries, but most of what happens at National Jewish is not the big discoveries, it's the incremental stuff. And that's what happens when you're building on discoveries and treatments that you already have. I'll give you just a quick story on it. I started initially at National Jewish in 1995. We have a school on our campus, the only school of its kind in the country that treats children with chronic diseases from grade 2nd to 8th. And these kids are just too sick to be able to sustain the rigors of academic world and emotional and social challenges that they face. In the mid-1990s, I would go there and see these kids that were really big and bloated, and they would sit down and their bones were so fragile that sometimes they broke them just sitting down. And every year we expected to lose like 2 or 3 or maybe 4 of these kids because, serious asthma. Mostly it was asthma at the time. Well, that's because we only had steroids. That was the ultimate solution to the most severe asthma. There was nothing else. Move forward in all the incremental discoveries, many of them at National Jewish, many of the treatment developments that were involved and that we were involved in developing have led to a totally different situation. You go to the school now, and these kids are thriving, they're learning to manage their illnesses, and they're going back into the society after 8th grade. My point is, that was all built on those incremental discoveries and treatment developments and different medications. And that's what that's all about. And that's National Jewish's underpinning of research. That's the monies that are going to come out of this event go to help support that. And that research enterprise, that engine of research has really driven a lot of our ability to provide care. And one of the brightest lights in our firmament of research is Dr. Tasha Fingerlin, who is with us tonight. Dr. Fingerlin is the vice chair of the Department of Immunology and Genomic Medicine, as well as the director of the Center for Genes, Environment, and Health. She is, no question, a rocket scientist, so I'm not even going to try to describe what it is that she does. I'll let her tell you that herself and share some of what makes National Jewish so great. I thank you all again for being here tonight, for your support. Thank you.
Well, thank you, Mark, for that glowing introduction. I can tell you that it is my honor to be here. I'm so thankful for all of you to be here, and I'm thankful that I get to represent some of what National Jewish is to you tonight, because it's my honor to get to work with my colleagues and be able to try to contribute to improving the health of people all around the world, first of all in our local community, but surely throughout the rest of the United States and the world. So I thought I'd give you just 2 examples of some research studies that happened in the Center for Genes, Environment, and Health that Mark mentioned. That center was designed and developed because we really wanted to understand why certain individuals would get very severe asthma, maybe as a child, and then grow out of it. Others would get severe asthma and never grow out of it. Or others would get severe asthma as an adult. But most people don't. So why did some people get it and some people didn't? Why did the steroids work for some people, but not others? Or the new treatments? There are still people that do not have good treatments for their asthma. So I thought I would keep with the theme of asthma and give you 2 examples of research studies that are happening. The first one in children. One of my colleagues has been studying severe asthma in children and has a study right now in Puerto Rico, because the rates of Puerto Rico in children there are higher than anywhere else in the United States. And one of the questions we have about asthma is that, first, again, why do some kids get it and some don't? Well, we know that after a child gets a respiratory infection, like RSV or something like that, sometimes that's the trigger. It's the first time they've wheezed, they end up in the emergency room, and that's often how they continue to get sick over time, is when they're sick. And so one of the questions was, well, are the kids who get viruses, does that damage the lungs somehow, that then you're more likely to get asthma? Or is it because there's something with your lungs or your immune system right away when you're born that makes you more likely to get sick and also to get asthma? So he actually, to be able to study this, we can't get samples out of the lung. We don't want to, I should say, in kids. We do that in adults, where they will literally shoot water down your lung, maybe clip out some lung, suck out all the water again. It's not something most parents are willing to sign up for. So he said, I need to be able to study the lung better to understand the genes, what's happening with the genes in the lung, and then what's happening with their environments. And so he actually was the first to develop the procedures to use swabs that before COVID no one knew about, but we actually use little brushes to go way back in the nose and sample some of those cells from back there. And what he was able to show, using adults first and then kids where we had a few lung samples, if you could get that sample from the nasal airway, the nose airway, it looked a lot like the lower airway, excuse me. And so he actually developed a way then to take those brushes, put them on a very special petri dish, and grow up those cells to look like the airway. So when you look at it under a microscope, you can see the different kinds of cells. You can see the cells that have the cilia that beat the mucus. So you can see the mucus beating. So he had a way to basically have a tiny little glimpse of what that lung would look like for each individual child that he could study. And so what was something that was impossible became possible on thousands of kids. And so now he's been following babies, their mothers, since before the babies were born, and then got these swabs right after they were born, and now is following them throughout their childhood, capturing all kinds of information on when they got sick, what's the air pollution good or bad around where they lived and where they went to play sports and things like that. And their goal is to be able to understand what about each kid, and as a group, can we know about whether viruses or the environments are the biggest triggers for why someone goes on to develop asthma. The other way that he can use his models is that we can test new medicines without having to give it to the child to see what would happen if you put it on these cells. It's not going to tell you everything about what will happen once it gets inside the body, but it gives you a really good idea, at least some initial ideas. So it's a really wonderful and amazing thing that we hope actually, well, for sure, researchers around the world use his procedure now. So he wrote it out, people around the world use that so that they can do the same studies. So we share things out that it can happen that way. So we hope that we can prevent asthma in the future, and until then, we can treat it better and understand how we can intervene sooner so that kids can have healthy lives and go into adulthood with healthy lungs. The second study I just wanted to tell you about was one that I was able to conduct with the former chair of medicine at National Jewish Health. And he noticed that individuals with severe asthma often came in with a lot of extra mucus that they were coughing up. It's a really common thing. So sorry to mention it, but it's a common thing that they have to deal with asthma. And that can actually be one of the fatal things. But he learned that some of these individuals would have really low-grade infections. They didn't have a fever. They weren't actually coughing like you would normally think about a cough. Their chest x-rays looked normal. But if he could send that off to the lab, sometimes he would find that they were carrying a certain bacteria or maybe even a fungus or a virus. And we didn't have a lot of treatments at the time, still don't really actually, for viral infections. We largely have to wait it out. But if he found that it was a certain kind of bacteria that he could give a certain kind of antibiotic for, he could take them from being a severe asthmatic on all kinds of oral steroids and make them mild. They could have a totally manageable disease on much less medicine. So he took individuals who would be in the emergency room often and made them mild, completely controlled asthmatics just by being able to do that. But one of his problems was he couldn't often figure out what they had. And so we worked with him to develop a genetic-based test from the sputum that they spit up. And we worked to develop a brand new test that can give him and other doctors a lot of information about what's happening in the lung for the doctor so that they can choose that right medicine and then be able to make choices that way. And so that's one that we've really tried to get into the clinic. So it's one of those rare examples where we can say, here's something we found, we did a bunch of research on it, and now we're trying to make it available as a test that doctors anywhere could order for their patients. And we're actually really happy to be partnering with some folks at Emory to be able to be one of those sites. And so it's just another way that we don't keep it all in Denver. We try to really disseminate and make sure that this is something that can benefit the broader community. So those again are just two examples. I have many colleagues. I wish I could stand up here and talk all evening, but that's not what everyone wants to do. So I'm happy though to give other examples if everyone wants to. And again, I want to thank you very much for your support. The research that we do could not all get done by just the grants. We do write lots of grants, we get them, but for the size of our institution, the tools that we have and the way that we're able to support research would just not be possible without help. So we thank you very much.
Introduce yourself.
Hello, everybody. I'm Billy Payne. I'm the man who got disproportionate credit for bringing the Olympic Games to Atlanta. The man sitting in this chair is the man who brought the Olympic Games to Atlanta. Let's salute Andy Young. I say that with a degree of certainty. Andy and I, in the 2-year period that we were bidding for the games, went to, I think, the accurate count is 77 countries. always chasing the person who voted. We didn't want to talk to anybody else. No kings, no queens, just the person that voted. And of course, we would always lead with Andrew Young. And they knew Andy, got to love Andy as we all have. And I'm here tonight, as you can tell, still hoarse from the Masters a week ago. In my particular case, I'm hoarse not from yelling for the golf competition, but yelling at my 5 grandchildren who are running around our cabin. Nevertheless, I had a wonderful, truly unbelievable 10 years in our Olympic effort, made possible not only because the man who got the votes, but the man who taught me so much. Among the most specific and the most enduring, the most important is to start off loving everybody. You may not end up loving everybody, but enter into all your engagements, all of your relationships with the expectation that you're going to have something in common. To have anything in common with Andy Young means that we have done something well. He is an extraordinary man. He is justifiably honored by National Jewish Health tonight and at our large event coming up shortly. I know we'll all be there, but it's so special for me to be able to say to the person who taught me so much how much I dearly love him. Second only to my father, this is the greatest man in my life, and for that, I'll be forever grateful. Let's salute Andy Young. So my last words are, thank all of you for your generous support of National Jewish Health. We're doing good, and that's what counts in the end. Thank you.
Thanks a lot, Billy, but I have a different play on everything that happens to me. It's all a matter of divine coincidence. And somewhere I heard somebody say, coincidence is God's way of remaining anonymous. Because strange things happen, and he never would let me pass on the credit. But 2 things happened that we had nothing to do with. One, I was born black in New Orleans, Louisiana, and 50 yards from where I was born was the headquarters of the Nazi Party, the German-American Bund. I was born in 1932. My father was a dentist, and probably because the Nazi Party was on the corner, he did business in the dental community. Most of the people happened to be Jewish. And so we never passed a day without talking about what was going on in the world. Now, my daddy took me to see Jesse Owens in the 1936 Olympics. Not in Germany, but to a segregated movie theater, the Orpheum Theater on Canal Street in New Orleans, where we had to go outside, climb up a rail and pay the same amount of money to sit in the buzzard nest, we called it. But I saw Jesse Owens run, and my daddy wanted me to see how Jesse Owens dealt with Hitler. And he said, now watch Jesse Owens. When he won, he was cool. He just cooled off and walked around and started warming up again. And in the meantime, Hitler walked out of the stadium and took, a couple of thousand stormtroopers in black suits with him. And my daddy said, now watch Jesse. What's he doing? I said, nothing. It looks like he's warming up. Warming up for another race. He said, yeah. That's the point I want you to get. Don't ever lose your temper in a fight. Don't get mad, get smart. He said if Jesse Owens had gotten upset, no matter what he did, he would not have been able to perform. And he went on to win 3 more gold medals. And I was 4 years old. Now, it took Billy a little longer. But he played football at Georgia. And if you could survive in Georgia in football, you were all right. But I don't know how he got dragged into raising the funds to expand the sanctuary of a Dunwoody Presbyterian church. And when he finished, he had pulled the whole community together when Dunwoody was new. And they produced a new church. And on the way home, he started thinking about, I've never felt this good about myself. No. He didn't tell me, but I found out that he was in his late 30s, but he'd had a heart attack in his early 30s. And was kind of recovering from that, and that's what brought him to the Presbyterian Church, one of the things. And his father had also had real struggles with a heart condition. And he went home, and what was on the television but 16 Days of Glory, the movie about the Olympic Games. And just 50, 60 years between my going to a segregated movie and him watching the Olympics on television. But he turns to his wife, Martha, and says, I wonder if we could bring the Olympic Games to Atlanta.
It was a wonderful, wonderful evening, an iconic evening, as we got a chance to meet the ambassador, Andrew Young, and I got an opportunity to share the work that National Jewish has been doing for 125 years. And it was very well received, and I'm grateful to be here in Atlanta, as National Jewish has been involved in Atlanta for a number of years. We've had events down here and have very good friends and have helped people like our host tonight, Paul Hagedorn. So we are very grateful for the opportunity to be here with you all.
I'd like to thank National Jewish Health for this occasion, but also for the dozens of times that I have been helped by the health concerns of, actually, most of our hospitals have been funded by Jewish entrepreneurs who have wanted to continue and expand the health of the universe. And I appreciate that, and I've been the beneficiary of it, and I thank you for it.